We're here today to discuss our mutual patient, 23-year-old female. She TANs regularly. She's previously been diagnosed with subacute cutaneous lupus, and she's now experiencing symptoms relatable to systemic lupus. Yeah. So, what are you guys thinking?
Like what is systemic lupus again? Like, can you review that?
Should define it.
Right here, it's actually characterized by a production of abnormal antibodies. So it's an autoimmune disease. Your immune system attacks the body's own cells and tissues in any part of your body, results in inflammation and tissue damage, and it's most common in females ages 15 to 45.
All right.
Common causes actually are high exposure to ultraviolet light, so high tanning, lots of tanning.
That makes sense.
Easily. Certain medications can trigger it. Viruses, stress or trauma.
It's a very wide range.
Yeah.
All right. Well, do you think we should look a little bit further into the symptoms that she's having?
Yeah, for sure. After my assessment with the patient, I kind of explained to her that there are specific and non-specific symptoms of systemic lupus. I noticed that she has a rash on her cheekbones and the ridge of her nose, which they call kind of similar. It's a butterfly rash. Photosensitivity, I would say for sure she's experiencing because she tans a lot and she's got rashes all over her skin. She says she's having lots of pain urinating, so kidney involvement.
Oh dear.
She has a low red blood cell count, so low platelets. So she has a bit of a mild blood cell disorder. So those were kind of the specific symptoms that I had noticed on her and that she had informed me of. Non-specific symptoms, she has been feeling very tired lately, she says, and she looked very, very tired from what I could tell. She says she also has been experiencing a low consistent fever, so I took her temperature and I felt her forehead, and her temperature and her skin was quite warm and her temperature was quite high. So,
Okay.
yeah.
That's not.
No, and with systemic lupus, you have to have 4 out of 11 specific symptoms to be diagnosed with this disease.
Well, she definitely has 4, so I mean, I guess that's kind of a concern. Yeah.
So what about treatment, Amber? What do you think?
Well, because systemic lupus has no cure, I mean, you're just basically managing their symptoms with medication to, bring her symptoms down and also prevent damage to the system. There's lots of different medications out there that, we could recommend to her, but some of the more common ones are anti-inflammatory drugs, antimalarials, immune suppressants to try to reduce that those abnormal antibodies, and also most of the time it's a combination treatment of different types of drugs. So I guess kind of assessing her for that first, because it can take months to years to get the right combination. So yeah.
All right. Well, good job, guys. Well, let's get on this.
Yeah, for sure.
All right. The integumentary system. Rashes, sensitivity to sunlight, and hair loss. The digestive system. Acid reflux, abdominal pain from buildup fluid in the lining of the abdomen, and inflammation of the pancreas. The central nervous system. Restricted blood flow to the brain can lead to seizures.
The circulatory system. Lower ability to make red blood cells, inflammation or scarring of the heart tissue, and poor circulation. The excretory system. Kidneys become inflamed, which results in problems with removing toxins from the body.
Immune system. Attacking its own tissues, which causes inflammation. Respiratory system. Lungs and lining of chest cavities become inflamed. Skeletal system, inflammation of joints. Chronic inflammation can wear down bone and destroy cartilage. Muscular system, muscle aches and pains.